Is Kana coming today, Cheryl?
No, she had a conflict.
Oh,
You get the two of us instead.
big shoes to fill.
I know.
Right. Yeah, I think we are ready to start, right, Danny? Yes, we are ready. Yeah, I was. Okay, I'll start and then, yeah.
Yep.
Okay, so good afternoon to everybody and welcome to this Brain Economy Davos Wrapped from Commitment to Delivery. I'm very much delighted to welcome you on behalf of the Euro-Mediterranean Economists Association, and also as recently being nominated as one of the founding advisory members of the Global Brain Economy Initiatives led by Harris Ayer, Executive Director. Thank you very much for joining us today after Davos. It was a very intense week. It was great, very inspiring, and we have a lot of ideas to implement. So, of course, this World Economic Forum annual meeting was really extremely important because it marked a real inflection point for the global brain economy. I think this initiative now is really being upscaled at policy level. And of course, for the first time, we clearly see that brain health, brain skills, and brain capital were not only treated as peripheral issues, but rather central pillars for economic resilience, productivity, and competitiveness. So the launch of the WEF McKinsey report on brain economy, which Harris has one of the co-authors, alongside with the global initiative on brain economy that Harris will talk about, and also the index that we formally launched last week, but all the report is online now. It really sent a strong signal from the community or to the community that brain economy is really moving decisively into global policy and economic and investment agenda. So I think now the next question is, and also to Harris and to colleagues and to all of us, what happened next and what are the deliveries that we will have to be doing in the next months up to the end of the year. So Euro-Mediterranean Economists Association, together with the Rice University and the Global Brain Economy Initiative, we are really thinking that this is an important moment to start a collective action making. And I think this is how we can make the difference collectively and quickly all together, each one from its own perspective. So for this 90 minutes, we will look at all these launches. I think we have the reports of the WEF and also the index and the Global Brain Economy Initiative. So we will understand a bit more what it means in terms of the policy momentum, but also in terms of the collective actions in 2026. So we are trying really here to move fast from narrative to implementation, from ambitions to pilots, and also from commitments to measurable impact. We at the Euro-Mediterranean Economists Association, we are extremely fortunate to be joining this outstanding group of thought leaders from academia, policy, philanthropy, and also private sector to really trying to shape and working together to shape this agenda under the leadership, of course, of the Global Brain Economy Initiative. So today I would like to see this opportunity quite fast and then share with you the main findings of our study. Of course, our study is the first attempt to measure brain capital based on the definitions that we have worked on together with Harris and other colleagues in a seminal paper of 2020 and also 2021 to build the brain economy. So if Danny can share my slides, please. I prepare, in fact, I'm going to prepare a couple of slides to share with you the main results of this, and to give us also the opportunity to see that it's possible today to measure. Of course, this what I call a living instrument is not, a static measure. So we will continue improving it. It's really coming or resulting from research. And it is important for us as academics and as policy, in economic policy, to collect more data and to have feedback, to improve, in fact, the methodologies, and to make sure that we are really capturing the reality as much as possible of our economic situations today and the challenges we are, in fact, facing globally. So the next slide, please. So here, as you can see, the definition, which is proposed, as I mentioned in the previous work, thanks to the work of Harris, it's really for us to refresh what we mean by brain capital, brain health, and brain skills, and this idea of accumulation of a stock over time per country. So our idea is really to use brain capital, which is the interactions between brain health and brain skills, as a stock for economies and for countries. Of course, we need to measure it, and at the same time, we know very well that there are elements that are boosting brain capital, and there are elements that are deteriorating or impeding brain capital to develop. The next slide, please. The structure of the index is pretty simple. So we have built the indicators based on data that we have collected over the past 4 years, and we kept updating through the Global Brain Capital Dashboard, which is freely accessible on brain health and brain skills, and we built an index. And also we looked at the brain capital enablers, which are in fact elements or determinants that allow the brain capital either to deteriorate or eventually to be boosted. And these are, for example, the health and well-being indicators, public health risks, for example, education and knowledge, and economic, cultural, and developments overall. So the Brain Capital Index mainly captures the mental health disorders, neurological disorders, and mortality and health outcomes. And of course, what we try to do also is to collect data on the brain skills, although we would like to see much more data on brain skills, but then we tried at least to capture the learning and skills development, innovation, knowledge creation. This is essential in the 21st century. And of course, some other subjective well-being and emotional states, which of course are essential in our construction. So of course, these arrows up and down, it's the impacts on that specific, on the brain, on the different indexes that we have. So this is just a simple structure. And then obviously we had, as economists, we tried to do a lot of computations to allow us, in fact, to build the brain capital index. Next slide. So here's the summary of the key findings, and I can invite you all, please, to look at the study. The study is co-authored with Harris Iyer, with 3 other colleagues from EMEA, 2 other colleagues from EMEA, and an expert who, Angela, who have worked with us on the brain health parameters. So next slide. So my first comment is to say that brain capital is critical and has been overlooked driver of economic performance. And the study clearly shows that in today's major challenges, like, for example, climate, demographic changes, digitalization, all these transitions, geopolitical instability and inequality, these are the challenges are not only economic, they are also cognitive and psychological in nature. So we need to capture them in our economic thinking. Yet, if we look at the standard economic metrics, like, for example, GDP, productivity, total factor productivity, traditional human capital indicators, which are our basis point, they mainly fail to capture the mental health, cognitive skills, and social capabilities of a population that underpins realistically the resilience and innovation flourishing and long-term growth. And in fact, without those metrics, we are really underestimating all these parameters in our matrix. The next slide. So if we look at the results, clearly the global brain capital has become much more vulnerable. It's in fact invisible to the policymakers, so it's very difficult to act upon it. So of course, these are based on indicators that we made it visible, and clearly we see that the Global Brain Capital Index shows globally a gradual improvement up to 2010, but then it's followed by tremendous volatility and decline, revealing how brain capital could be highly exposed to external shocks. A crisis such as a financial crisis, COVID-19, may cause lasting damages, particularly in countries with weaker education system, health system, and social protection capabilities. So, of course, for the moment, what you see here are the trends. And as economists and as researchers, we will go further and dig on the explanatory variables, why this is happening. And of course, we need to look country by country to allow us to understand the underpinnings of all these changes. Next slide. So another important conclusion is that brain capital remains highly unequal, but convergence is possible. Brain capital is unevenly distributed across countries, regions, reflecting disparities in education and health system capacity, social protection systems, and institutional quality and innovation ecosystems. So, but then the index also shows early signs of convergence. Lower income and lower middle income countries are improving faster, especially in brain enablers, suggesting that progress is achievable with the right policies, with intentional policies. So if we have a normative approach, eventually we can revert the trends. But of course, we need to consider those elements as priorities. Next slide. Now, OECD countries outperform overall the world, of course, but brain health gaps are in a way misleading. And we need to understand also that we have taken a lot of data from public sources, but then at the same time, there is a lot of under-reporting in many countries. So, but overall, on average, OECD countries score higher than non-OECD countries, particularly in terms of enablers, institutions, and infrastructure, which is the basis infrastructure of brain capital. Also, in terms of brain skills, learning, innovation, and well-being overall. Of course, we understand why. But then in terms of the brain health indicators, it shows large variabilities simply because in many non-OECD contexts, weaker diagnosis capacity likely masks the true burden of mental and neurological disorders, meaning that disparities may be underestimated rather than smaller. So we encourage the community really to get more data, more diagnosis, and this is essential in the projects eventually that Harris will talk about later on. We need much more science project from neuroscience to be able to do this diagnosis and get more data at a national level. Next slide, please. So this is important, and these are the infrastructure, brain capital infrastructure. So brain enablers are highly sensitive to economic shocks. Education systems, health systems, and social protection mechanisms prove very much fragile if they are not very strong during crisis. Countries lacking institutional resilience experience overall sharp and persistent declines in brain capital following economic and health shocks. And we've seen it with the COVID, with long-term consequences for productivity and social cohesion. Of course, this we can avert it. Next slide. This is important, and again, with the same caution on the data on brain health. Brain health overall is under global strain. The index documents declining trends in brain health in many regions, of course, driven by population aging, raising mental health burdens, and cumulative and economic and health stressors that we live in every day. So, but despite the economic importance, brain health remains systematically underfunded and underintegrated into policy frameworks. So it has to become a priority into the policy agendas. The good news, next slide, is that brain skills If we foster them, they are improving, but again, unevenly measured. So we can measure further through collaborations. For example, we use the learning outcomes, innovation, subjective well-being. They show global improvement, reflecting gains in education, knowledge access. I would explain the fact this because we have a human capital index that is measurable. So this is why the skills part is improving over time. So again, the assumption is when we measure, we can act upon and we can change policies and we can change outcomes. But again, we still face the data limitations, especially, for example, in terms of the uneven assessment systems, which means that progress may be overstated. So next slide. One thing important from this research is that income alone does not determine brain capital. So income is not the destiny. So countries really with similar income levels often show very different brain capital outcomes. Long-term cross-sectoral policy choices spanning, for example, from health, education, environment, labor market, and institutions are decisive. So all these pillars are for actions for public policy. Next slide. Systemic resilience is a decisive factor. We need to have strong institutions, democratic institutions, inclusive policies, resilient enabling environment to better able to protect brain health during crisis, improve brain skills overall, over the lifespan, and also translate these brain skills into economic and social outcomes, but at last also to sustain long-term development. My last slide is to say that this index could be a new policy compass between GDP. Of course, GDP is important, but we have to go beyond GDP, and a lot of effort have been really trying to do so. This can be a strategic instrument. It's not only a measurement instrument, but by making cognitive mental foundations visible and benchmarked, it supports a shift toward the brain positive development models and economy, as Harris mentions all of the time, that prioritize resilience, inclusion, learning capacity, and human flourishing. So to finalize my comments, just the last slide, just to show you the shifts, then this index will provide us a shift from human capital. Of course, human capital framework index is an economic framework that has worked. We go beyond, we move beyond productivity focus to purpose focus, from a peripheral health, considering health as a peripheral issue, as a residual in the function, it becomes a core infrastructure. From quantity-based skills into neurocognitive assets, so we can invest in them. From an individual investment to a system design and overall system change. And of course, from growth to resilience. And I hand over to you, Harris. These are the main results, and we have a lot to talk about, but of course, this is really the highlights for our report. It's publicly available, and really, whoever has any comments, we're very happy to take and discuss. Thank you. Harris, to you.
Wonderful. Thank you so much, Rim. That's quite astonishing results and a lot to process. And really, we've never seen those results before. So I'm processing that on the fly. I think we have a lot of work to do to unpack the story that you shared there among those slides, and to get the word out. And then I really appreciate, Rim, that you're already thinking about a monitoring process to feed the index into a sort of multi-geography, multi-sector, multi-industry community that can leverage those insights and then also obviously improve the index over time. So thank you. Now, without further ado, I'd like to turn to Lucy Perez and ask you, Lucy, about tell us a little bit more about the report and how it was received last week. And then after that, I'd like to ask you about sort of your broad perceptions of Davos and the brain economy's influence in Davos. But take it away, Lucy. Thank you.
Yeah, no, and thank you, Harris, and thank you, Rem, and EMEA for having us here today, right? Because I think one of the things that gives me the most pride in this work is how we've worked together, right? When you're tackling something that is of a monumental scale, it's like what we're trying to do here, which is really bring together a common understanding, a common set of definitions and frameworks towards a shared goal that people can all take action. It just takes massive amounts of collaboration. And I think we have a lot to celebrate in how the different Pathfinder groups have come together to contribute to this report, right? And I'm guessing everyone in the audience knows the report already, but we can put it in the chat should anyone want to have the link handy, right? But let's start with what the reception has been. I mean, it was extremely positive in Davos, right? I think there's a clear acknowledgement that there's no more urgent time to invest in brain capital than right now, right? There was a constant theme to a lot of the conversations in Davos having to do with the demographic shifts that we're experiencing, the geopolitical shocks, the economic shocks, right? The way technology is impacting not only the workplace, but also our daily lives. And as you think of each of these, the centrality of the brain to not only, let's say, work through that, but really to thrive, it's absolutely essential, right? So, I mean, this report was part of the conversation. We're trying to like tag the number of sessions, over 20 sessions, right? Over the course of the 4 days in Davos, whether you're talking a session in the Congress Center around healthy workforces that touched on it, right? To sessions in the Ice Village touching on longevity and healthy longevity and how essential thinking about brain health and brain skills is to enabling a healthy longevity, right? To many sessions. I mean, we had VLab where this and, you know, the related efforts like the Global Brain Capital Index were a core part of the conversation there. And so throughout, I think there was that recognition, the time is now, right? There was also what I thought was really interesting. It's something that came up quite a bit in a fireside chat that we did with the CEO of Foreign Policy, was this idea that this applies everywhere. We're not just talking about certain industries or certain geographies or certain demographic groups, right? Everyone really has a role to play. And I think what people really want, well, I'll say one of the things that people share that they really valued about the report is the pragmatism around how to take action, right? Like an aligned framework, right? Like we know this is about safeguarding brain health. It is fostering brain skills, right? It is how, you know, we study, invest, and mobilize for brain capital. And this idea for too long, we've had, you know, different groups, and there's been a lot of groups doing a lot of really important things. And this says that we now have this alignment built around this shared framework and how to take action. These developments like the Brain Capital Index that bring more tools so that we can measure and think about how do we ensure that progress is in the right direction becomes really important. I was part of a private CEO roundtable that happened on the Tuesday in Davos, and it was really inspiring to listen to some of these CEOs who were saying like the strong belief that they have, the data that they've been looking at from their own organizations to see that the ROI around these investments, both in brain health and brain skills, are really translating not just into greater productivity, but actually much greater innovation in the way that their teams are developing new products and services, how they work together. And so this sense that, yes, we have to act now. The brains are more important than ever. And we have tools, right? We're not starting from scratch, but there's a lot of known evidence that already exists. You know, with us at McKinsey, we like numbers. And the number that folks, you know, kept gravitating towards was this idea of like, we know that scaling existing brain interventions already is going to unlock over $6 trillion in economic opportunity, right? Additional GDP contributions. And that's with innovation we already have in hand. Imagine if we see continued and commensurate investment for new innovations, that number is just going to continue to grow. So I'll pause here, but as you can probably sense from the way I'm speaking, just a lot of excitement and also just a lot of gratitude for the collaboration that made all this possible.
Wonderful. Thank you, Lucy. and certainly, it's the technical expertise of McKinsey Health Institute that shone through last week with the report and the analytics and the data, but also your passion and personality shone through. So thank you for all of what you do to lead this work. I think you and Rim have effectively covered the role of the brain economy in boosting nation state productivity and economic growth. But maybe the last question I want to ask you was about organizations. You published a Fortune op-ed or letter with the CEO of McKinsey around the role of the brain economy in helping with sort of transformation of organizations in the context of brains and AI. Could you talk a little bit more about your vision for organizations at that level, please?
Yes, no, we were thrilled to see our op-ed published in Fortune. We can probably put the link in the chat for any who may not have had a chance to see it, which is all about the criticality and centrality of human intelligence, right? Now more important than ever, and how critical it is to organizations, and indeed a testament that our own global managing partner, Bob Sternfels, feels so strongly about. And this was one of the messages that, not only in Davos, but before Davos in several sessions at CES, for example, we've been really trying to emphasize the criticality of, the workforce and their health, right? Because we often talk about how our workforce is the most important asset of any organization. Well, there's a slight tweak to that. It's not just the workforce, it's their being in, holistic health, right? In how we're thinking about their physical, their mental, social, and spiritual health. It is absolutely essential to that idea that this is not just about productivity, but it is about growth. It is about innovation, and that the evidence is getting increasingly, abundant that organizations that make these investments are reaping outsized rewards, not only in terms of, again, their own growth, but just the way that their individuals are thriving and the commitment to those organizations.
Excellent, thank you. And I can see that the Fortune article has been shared in the chat. Lucy, let me ask you one more question, because it sort of, between nation states and organizations, obviously regional economies.
Yes. We
had a wonderful lunch on the Wednesday in Davos that clashed with another lunch that you were hosting. The lunch was around working towards a community of practice for place-based brain economy initiatives. We had representatives from Spain, from Houston, from California, Pennsylvania, Africa, Geneva. Could you tell us, and I apologize, this is an unexpected question, what advice do you have for us to try to develop a community of practice that balances some sort of common approach to brain economy regional initiatives, but also allows for the unique manifestations of culture and socioeconomics and industries sort of around the world? That feels like a complex strategy question that's perfect for you.
Well, let me see if I can take it all, Harris. But look, we started, and you probably called on me to talk about organizations and employers in particular, because we know we spent about a third of our lives at work, right? And so employers have a massive role to play when you think about how much of our time links back to being part of an organization. But again, it's only a third, right? And when we think about I think when we think about brain capital, it's really important to take this lens of the life course, right? If you take just, for example, brain health conditions, right? One part of that brain capital equation, we know that the burden associated with brain disorders, a lot will manifest, like about half of it will manifest by age 14, grows to close to like 70% by age 24. And so it's not just about employers, right? Everyone has a role to play here. And this is why place-based strategies are so critical, because it is about how you bring together the different stakeholders that collaborate and build on each other, whether you're talking about educational systems, right, which are, some of the first places where individuals develop some of the brain skills that become so important, again, throughout that life course. You're thinking about the health systems, right? You're thinking about policymakers. you're thinking about so many different stakeholders, and what a place-based strategy allows you to do is really aligning efforts so you can be synergistic, because all these things take a lot of investment. And so if everyone is doing their own siloed thing, we're missing and leaving value on the table, right? And what a place-based strategy allows you to do, it's really build on the strengths of different players in that ecosystem. It is agreeing on ultimately what the aspiration is. What are we solving for? And how do we make sure it reflects the characteristics of our community? Because while this is a framework, right, that we put forth in the report, we recognize in approaching a topic like this, it's not a one size fits all, right? Like what we're going to be doing in Houston is going to be exactly the same thing that's going to work for Madrid or Barcelona, right? Or it's going to be the same thing that's going to work in Lagos, right? We really need to take into account the local needs, strengths, and capabilities, right, as we think about how best to set it up for success. One thing, by the way, that we didn't touch on in my comments so far, but Harris kind of alluded to, I couldn't join a lunch because I was in a different lunch. It was because we really also wanted to think not only about the lens of the life course, but actually the lens of sex-based differences. When it comes to brain health, right, and brain skills, we really need to also understand that it's also not a one-size-fits-all necessarily from a sex and gender perspective, right? And so whether it is when we're taking a look at understanding the impact of dementia, where we have 2/3 of the patients being women, 70% of the unpaid caregivers also being women. That's what we call that double burden of the brain economy. So it is really essential that as we work through these things and think about what are we studying, what are we measuring, what are we investing in, that we're ensuring that we're solving for everyone in doing so. Let me pause there. I see that Rem has her hand up. Mm-hmm.
Yes, thank you so much, Lucy, for that. I'm going to share the link to the Nature Mental Health article that you published on women's brain health and brain capital. But Rem, you have a question.
Yes, it's not a question, Harris. It's something that we, to complement what Lucy was saying. Actually, brain capital can be framed also as a human resilience factor. And then this also will help into the long-term value driver. Through what? Through the matrix that exists already, which is the ESG. I know this ESG environment, social and governance metrics, that they are quite present in different countries. And I think the action could be easy, is to really develop a brain capital investment type of metrics that is connected to the ESG. That's really a way to upscale pretty fast, because at the end, what is missing in the ESG is the S, and the human resilience. It's very important in the social, what I call. So this is a quick win, in fact, to apply to companies and to also lead to enhancing the investment into this type of companies that are, of course, ESG compliant with brain resilience thinking.
Wonderful, thank you, Rim. Maybe I would add at this stage that we were grateful, in addition, Lucy, to McKinsey's engagement last week. We also were delighted to host very senior executives from JLL, the large global real estate company. Sanjay Rishi spoke with us on Wednesday morning, and then we had private meetings with Sue Osprey-Price, where we acknowledge that JLL is absolutely leaning in on the brain economy with their brain gym structure. So there'll be more announcements coming out from JLL. JLL also spoke about their collaboration with BP, British Petroleum, which has a very large global brain economy initiative for their workforce, which JLL spoke about publicly, but more announcements will be coming out soon. So that was terrific. We also had University of Texas Medical Branch, a large academic medical center, announce itself as the first full sort of embracing brain economy organization in the world, and how they're doing brain economy activation through their science, through their clinical care, through their innovation, through their community work, and through their workforce. and perhaps I can share that link to that press release. And so in that vein, I wanted to call on Susan Arminger, the CEO of Catalyte. Susan, we're very grateful for your partnership last week and for your leadership of the value-based brain health care discussion, but also your leaning into organization-wide brain economy approaches with Catalyte. So I wonder, Susan, if you could share with us your reflections on Davos, and then specifically some thoughts about what this means to your organization, and then also to Catalyte's leadership in value-based brain health care and other innovations that you're leading through your various holding companies and other companies. So Susan, over to you.
Thanks, Harrison. I am excited to be here today and continue the conversation and that momentum that I certainly felt last week in Davos. So I think we at Catalyte, our real focus in Davos was how do we bring the conversations of brain health and value-based care together. And I think that we were able to do that, at least begin that conversation. I think there was tremendous momentum generally about brain health and all the different aspects that come together and our brain capital enablers. So it was exciting to hear all of that and to feel it kind of build across the week. Specifically around brain health and value-based care, I think what we're seeing and what I certainly took away from the WEF and McKinsey Health Institute report was that poor quality healthcare has a significant impact on brain health. This was a theme throughout the report. And when we think about what's going on in healthcare and in the value-based care world, it was very interesting to me last year when I was first introduced to brain health. I'm pretty new to the conversation. The significance of the cost of poor quality health care when you connect it to brain health. So in the US, we know that we're spending about $5 trillion on healthcare. Obviously, that's much larger globally. And yet we don't have any proportionally improved outcomes for people. And when I think about the brain capital enablers of health and well-being, and particularly public health too, there is significant harm to individuals, businesses, communities, and of course economies because we are not using a value-based care approach. And by that I mean that we're not, value is not being delivered per dollar spent in healthcare. And I think that's true for the patient themselves, their caregivers. People have talked about that today. Lucy, you talked about the workforce. So it's the healthcare workforce as well as the funders, so the cost of the care itself. And so we're really interested in bringing this conversation together and strongly putting forward the idea that equitable, timely access to care, we need to shorten wait times, we need to really look at caregiver burnout, which is considered a public health crisis today. And I think the increased inequality, we talked about that generally in brain health, so we see exactly the same in access to high quality health care. And I think it's just really important that we also look at things like administrative complexity. So one of the big factors in burning out caregivers, patients as well, but particularly caregivers, is the complexity of navigating the healthcare system. So how do we bring all those things together and have, I think, more direct and specific conversations between the brain health, the momentum that people that have about brain health and how we really bring the value-based care conversation to the fore of that work.
Wonderful. Thank you for that overview, Susan. And it's obviously such a critical lever to pull for the brain economy transition. And perhaps we can share more. I don't know if that session that you led was recorded, but you moderated a panel with Kaiser Permanente, Roche Genentech, UTMB, at least, and I perhaps have forgotten someone.
North Carolina.
Okay, yes, that's right. The Secretary of Health for North Carolina. So very, very impressive panel and stakeholders. Could you tell us about the CBS documentary that you're working on, and what folks should expect and when they should see that coming out as a wonderful product and summary of all of your work and leadership and the work in Davos as well?
Yes, we're looking at, as I said, bringing all the different conversations together around value-based care and its impact on brain health. And of course, we are at Catalyte. We are specifically focused on the autism community. We deliver value-based care services to people with autism. So we've been some of the information in the video will be specific to autism. But we feel very strongly that the way we're delivering services, home and outside hospitals, home and community-based services, is a model that could be used across behavioral health generally, and certainly in some of the concerns there are about mental health services being delivered and the quality and availability of those. And we want to look at different perspectives across the value-based care continuum, from certainly globally. So we're looking at how we might be partnering globally to really understand how we can get some momentum going and some understanding of the economic impact of value-based care in and of itself. But when it connects to brain health, we then have it just really created something that it seems to me would be impossible for people to not be paying attention to when they're thinking about healthcare.
Wonderful. Thank you. And last question, Susan. We're so recent coming back from Davos, so we got you're thinking through your strategic planning, but what thoughts are in your mind about really helping to mobilize value-based brain health care for providers and payers? What sort of insights or frameworks are you considering at the moment developing, and that you might call on people to collaborate on to really action this further in the next 12 months?
Yeah, I think one of the really important ways that we need to further this conversation is partnering. Rem and I have talked about this, for example. We need to demonstrate the economic impact of value-based care in different scenarios. I think one of the barriers to people moving forward is they don't understand, first of all, how to do it. I'm not suggesting it's easy, but there are some frameworks we can use, and then they don't always understand the economic impact of it. Like how would this really work in a kind of a win-win-win scenario? So I think it's very important that we get very practical quickly on how we're talking about this, and instead of just the concept of value-based care. I mean, I could talk about that all day, but that isn't necessarily what's going to move this conversation forward. So we're really excited about partnerships so that we can get some real practical information out to people on how this can be done and why it's so important and the value it brings to all the stakeholders in the story. So the patient, the informal caregiver, the workforce, and of course the funder and the economy.
Wonderful. Thank you for that. We look forward to collaborating on that, and call on other folks to reach out to collaborate. And so everyone should know that Susan is very special. She's not just an executive that is doing this work. She is also a PhD student, in a sense, executive scholar, studying value-based care and value-based brain health care. So thank you, Susan, for a sensational PhD that you're doing, because you're in the middle of it, and then you're going to Davos to convene and lead other people around the topic of your thesis, which is a real maybe that's never been done in a PhD's history, to actually integrate the sort of this kind of level of work in the process. So it just speaks to your courage and wisdom of what you're doing. So anyway, thank you, Susan, very much. And there's some nice comments from an Aussie to a New Zealander as well.
I thought we'd get there eventually.
Okay, next I'd like to turn to Cheryl, co-director of Brain Health at the McKinsey Health Institute. Cheryl, I'd love to get your general reflections on the conversation that we're having here in this webinar today, then your reflections on Davos, but then specifically, could you tell us more about the WEF McKinsey Health Institute Brain Economy Action Forum and how you see that evolving here in the near future after this momentum of Davos? So that's a lot of things, Cheryl, but I hand the floor to you to share your thoughts.
Yeah, no, thank you for having me. I think this conversation reflects a lot of the excitement that we've heard around both the report that World Economic Forum and McKinsey Health Institute put out, and also just all of the dialogue, some of which we were a part of, some of which we were not, that was happening in and around Davos. So, you know, I've heard from a number of people across different sectors, some of them very core to a lot of the conversations we have on this topic, and some of them very kind of new to it, who have reached out and said, I'm hearing about this thing, it's exciting, it really resonates. So we're just delighted that this topic is getting visibility, and the visibility that we all hoped for coming out of Davos. And I would reiterate Lucy's earlier comments, specifically on just the gratitude for the collaboration around this topic. I think it's been amazing through the Pathfinder group that was organized under the WEF and MHI umbrella, as well as just the broader collaboration, Rim, Harris, Susan, others, you know, that you're leading and that you're a part of. So one thing maybe I would just add, and then I'll talk a little bit more about the action form, but I saw a few comments coming through in the chat around education systems, around kids. I think everyone who's talked today has acknowledged that a little bit. I will say from a McKinsey Health Institute perspective, that's an area where we really want to focus in the coming year. The report that we put out certainly acknowledges the importance of thinking about these issues across the life course, and the importance of investing in early childhood and in youth more broadly. But as we think about the workforce, we always also need to be thinking about the workforce of the future. And we know that those investments have to start early and yield a lot more when they do start early. So that is something that is top of mind for us. And in particular, just a kind of general open invite that I think we, one piece of feedback that we heard at Davos is, you know, there's not a lot of the traditional education sector folks in some of these rooms. And so to the extent there is interest, that is something would be delighted to explore and to continue to build out our partnerships in that space. Specifically to the action form, I mean, Harris, I feel like I'm going to end up tossing this back to you, but for those who are a little less familiar with the action form structure, so action forms are something in general that World Economic Forum sometimes sets up. They're intended to be time limited and focused on kind of building community and catalyzing impact around a specific issue in a sort of specific special period of time. So we set up the action form with WEF starting end of year before last, I guess, now that we're in 2026. And, you know, it really used that group and kind of the energy and knowledge to first just make sure, or try to help ensure that everyone is aware of what's going on right in that community when there are events that we can mutually lift up and amplify to do that, but also to really rally around this report that was just released to make sure that the messaging was as strong as it could be, that it kind of gave appropriate due to all of the work that has come before and highlighted some of these tools like the Brain Capital Index that we know are really critical for moving this work forward. Looking ahead, you know, we're planning to keep the action form going around brain capital for the coming year. We see a ton of value in it. The community is continuing to expand. We're continuing to add new Pathfinder organizations. But we also recognize that it's not the long-term home for a lot of the collaboration and leadership that needs to happen globally. It was always intended to be a time-limited exercise. So we're delighted, Harris, that you have successfully launched the Global Brain Economy Initiative, and really see that as a wonderful opportunity to build and scale the kind of strategic thinking and collaboration that we know is needed globally. So the action form will kind of continue over this coming year, but longer term, we know that entity is there and can help to drive the work forward.
Wonderful. Thank you, Cheryl. I appreciate it. Did you want to make any more remarks about the children and youth focus that MHI is taking in the next 12 months? Just to double click on that a little bit.
Well, now I feel like I have to. So no, I'm happy to.
Yes, I should say, please share a little bit more.
No, I would say a couple things. One is, kind of as I referenced before, we feel like we didn't really do that area. We did no area its full justice in this report that was put out, right? It was all very high level. It was a, global roadmap. And so by necessity excluded a lot. And we just know this area around youth is particularly important. And we also know we've been a little light in our Pathfinder community on kind of the coalition that we've built focused around that. So that's really why it's a priority. In terms of specifics, we're still exploring exactly what makes sense, but I think broadly the types of things that we're interested in exploring more are really what are the components that kind of build towards brain capital and kids specifically, right? We think about education systems, things like prenatal care, nutrition, sleep, home environment. I mean, the world is very big, but trying to think about where we might be able to add value as an institute and in collaboration with others to just better understanding, what is the cost of inaction in some of these areas? What's the potential return on investment, and really lifting it up to a new and diverse set of audiences, because there are groups you go talk to who know very well that when we talk about early childhood education, we're talking about 9-to-1 ROI or greater with a really strong evidence base behind it. But then there are a lot of groups where that's not, it's not top of mind, and they're not really thinking about it as they think about the trade-offs that they make in terms of investment. So that's a focus for us. The one other thing I'll add is, similar to, on the brain health side of things, we're also cognizant that we don't want to encourage just moving dollars around, right? I mean, we all acknowledge sometimes there's money that could be better spent elsewhere, but it's really also about growing the size of the pie. And so encouraging a diverse set of investment, not just public dollars, not just philanthropy, but really thinking about how we can unlock some of this investment in the private space as well.
And if I just may add on what Cheryl has been sharing, right? I think we're extremely proud of this report that, we've collaborated with so many of you on. But what we're going to be incredibly more proud about is the impact, seeing it in action, right? And so as I think about what's really true for next year, indeed, going deeper, and there's so many areas, early childhood being a primary one that is, of course, of great interest to us, amongst others, but it's also then the doing, right? In whether it is with organizations or places, but how do we make sure that this roadmap, this framework, it's put in action and realize that opportunity that we're talking about. So we're very excited about that as well.
Thank you, Lucy. Yes, I think that's a great point to talk about. We're moving now from insights to action, and you're manifesting that through MHI. Susan is, RIM is, but also this Global Brain Economy Initiative is an action platform, and so it's fitting. That's the insights to action transition, which our whole transition is to go from brain negative to brain positive for nation states, for regions, for organizations, for people. I also think the other transition that we're getting at is to go from invisible to visible. As Rim said, brain capital is historically invisible, and as of today, Rim has made it visible. So there's a kind of it's again profound that there are many of these transitions that we're pushing under our broader umbrella. Let me make a couple of additional remarks about some of the key themes that came out of last week from my perspective. Of course, we had wonderful economic data in the report. Lucy mentioned the six trillion plus economic value of the brain economy. Last week, we really also dived into spirituality, the importance of spirituality on the softer side of things in driving the brain economy transition. How do we engage with, for example, First Nations communities in this economic transition? We had a wonderful person, Cheryl Batchelor from Australia, actually from my home state, who runs the EMEA Indigenous Corporation, talking about how she's mobilizing economic transitions for productivity, but with a First Nations spiritual and community context and cultural context. So that was very impressive. Also, we started the week at the TPC House, which is a special house funded by the generous philanthropist Fred Sau, who specializes and emphasizes East-West spiritual connections and how Eastern spiritual philosophy can infuse through businesses in collectivism and perhaps he would say a more enlightened approach to business. And so Fred allowed us to have some running room to explore the brain economy, yes, for productivity, but also for consciousness raising in an Eastern context. So that's just something I wanted to mention because folks may not have expected that we would be touching deeply on spirituality, but we absolutely did. And of course, Ayadi is a proponent of natural capital and the role of looking at the linkages between nature and brain capital, which is very profound. And you could argue in some ways spiritual is the understanding of ecology and how that influences our brains, and then how our brains influence ecology is a frontier which has many spiritual components as well as ecological components. We also produced on Tuesday a major report through the Building Brains Coalition on the role of the built environment and real estate sector in the brain economy transition, recognizing that we spend a lot of our days inside, in our homes, in our office buildings, in schools, in hospitals. And those can now, thanks to neurodesign, neuroarchitecture, be engineered and designed for our brains, for creativity, for productivity, for stress reduction. So, this is, again, like value-based care as a big lever to drive this transition. The real estate sector is another big lever, given real estate's the biggest asset class in the world. And we, of course, want to propose that the human brain is the biggest asset class in the world and the most precious asset class. And so the Building Brains Coalition is a wonderful network that's driving this work of design companies, architecture firms, real estate firms, banks, etc. So that's another thing. And then also we produced a report last week as well on the brain economy and the post-SDG agenda. How does the brain economy provide a new opportunity for human development beyond the SDGs, which sunset in 2030? So we're starting now to think about how to influence and engage in that sort of 2030 to 2040 post-SDG agenda and thinking through innovations in human development through the lens of the brain economy. So anyway, I'll stop there because we could keep going, but hopefully that gives folks a sense of some other elements. Let me now just touch briefly on our brain economy initiative. This is a deck specifically. Can folks just checking that my screen is sharing?
Yep.
Okay, great. So this is a flyover of the Global Brain Economy Initiative. I'm going to skip through the slides and acknowledge that this was developed, this action platform, thanks to the Global Coordination Strategy, which was developed collaboratively between McKinsey Health Institute, Milken Institute, High Lantern Group, and the World Economic Forum. It's a very comprehensive strategy to build this platform with interviews of experts and stakeholders all around the world. The goal of this platform is knowledge development through novel forms of science, and we have some announcements that we'll be making in the coming weeks around that. It's through thought leadership and communication. It's through cross-sector collaboration and through mobilization. And I think you see that today, thinking about organizational transformation and regional economic approaches. I want to give a shout out to these Lighthouse regional brain economy initiatives that are happening. Project Medicine Houston is perhaps the first cab off the rank, but we're now in deep discussions with the Brain Coast Group, the Palm Health Foundation. Penn State is leading a more brain skills oriented strategy, and in California, we're now engaging more deeply at UCLA and with UC Berkeley as academic institutions that we can rally other public-private philanthropic stakeholders around. We have a UCLA summit on this topic in March, which we can share details with if anyone's interested. Important to note that last week, Geneva announced that it is now pioneering a brain economy transition in their city which is very much AI enabled and neurotechnology enabled. So that's a sort of a unique flavor of brain economy transition. Here are some other commitments that came out of Davos last week. We've touched on many of them already. So there are major convenings coming up, and I'm happy to share this slide with folks that are interested. And if you see the traffic and comments on LinkedIn, you'll find these things. And perhaps we should say that we were also delighted last week to engage with key leaders mentioned here in the bottom right, the Chancellor of UC Berkeley, Rich Lyons, the President of EPFL, Anna, the Chief Health Officer of Kaiser Permanente. Bill Gates was engaging in the brain house space with his story, personal story and actions around Alzheimer's disease and dementia, the head of the World Health Organization. We mentioned Bob Sternfeld's work with Lucy and the Fortune article. So this gives you a sense. We are in the process of building out the Global Brain Economy Initiative, as Cheryl mentioned, in very close collaboration with the WEF Brain Economy Action Forum. And so we're in the process of building out governance, working groups, funding structures. So if anyone's interested, please reach out to me if you would like to be involved in that. So I think that's what I wanted to share about the action platform. I think we've had a great discussion wrapping up Davos, from Rim talking about the index to Lucy talking about the report and her other pieces and highlights from last week, Susan covering off on the healthcare piece and the role of neurodiversity, and Cheryl on the Action Forum and other work from the McKinsey Health Institute. So unless anyone has any further comments, any of the panelists, or any major questions from the audience, we can probably wrap up. Rim, would you like to say some concluding remarks?
Thank you very much, Harris, Cheryl, Lucy, Susan, for this very comprehensive discussion. And I must say that we are now having a roadmap. We build a roadmap around the Global Brain Economy Initiative, and this collective action that we all are part of will allow us, I would say, to go progressively, but at the same time with firm steps to make a change, a system change. And I think this is what we have been aspiring for since 5 years, Harris, and this is becoming a reality. So beyond, and of course, the places that you mentioned in the United States, also Spain is moving into a place for brain economy transition, and we are working with the important stakeholders to make this transition. And also the index will allow us to have a compass to see where we are and where we want to head in the next couple of years, so we can revert the trends. And this is so important to be able to measure the change, so the impact. And this is what you mentioned, Harris. We can have a monitoring tool using this index and eventually other indexes at different levels individually, also at a company level and also at a country level. So it's a massive work, and we need huge level of collaboration, but it's in there, and I'm so happy to be part of this collective. And thank you very much, Harris, all of you, and we will continue working. So I think just to be continued. And our next webinar, it's about brain capital and brain economy and democracy. So stay tuned. You are muted.
Yeah, thank you so much, Rim. Yeah, so stay tuned for more webinars and engagements, and then also as the platform, the Global Brain Health Initiative platform develops, which it is doing rapidly. After last week, we will be sending announcements and forums and dialogue and chat groups and such as fast as we can. So we're working. So anyway, thank you all for your time and attention, and we look forward to staying in touch.
Thank you all. Thank you for your time.
Thank you.